So welcome everyone, and welcome to our presenter, Dr. Doris Howell. Dr. Howell is heading up our new Cancer Coach Institute, a summer institute that we'll be running. She holds a position as a senior scientist in supportive care at Princess Margaret Cancer Research Center Institute. Cancer Center Research Institute. And she is a professor at the Lawrence S. Bloomberg Faculty of Nursing with a cross appointment in the IHPME University of Toronto. She's also an affiliate scientist in the Electronic Living Laboratory for Intervention for Cancer Survivorship Research at the Health, Wellness, and Cancer Survivorship Center at the UHN here in Toronto. She's also an associate scientist at the Institute for Clinical and Evaluative Sciences at the University of Toronto. With those accolades, Doris is also a teacher and an instructor, and she holds an RN and PhD. And again, she is the program director for our Cancer Coaching Summer Institute certificate. But today she's presenting on a very important topic here in HLN, here at York University, and for herself, and that of enabling patients, survivors in cancer self-management and the healthcare model of the future. Without further ado, I'm going to pass this over to Dr. Howell. Welcome.
Thank you, and hello everybody. It's great to be here. Just to let you know, if things get a bit sticky with the slides, my little mouse is having a little bit of trouble with the humidity in my house. My air conditioner is broken, which is not a great time, but that's what's happening. So it's great to be with you today, and I'm going to start the presentation right away. So you all had a copy of the objectives. My goal today is really to talk about cancer coaching and talk about its application across the continuum of cancer, really highlight some of the essential elements of cancer coaching, and then of course looking at why is cancer coaching so important when we think of cancer populations. So, you know, one of the most important things that's happening globally, of course, is the focus on chronic disease self-management, really to try and achieve the triple aim healthcare reform goals of better health, better care for interventions, and hopefully at lower healthcare costs for cancer populations, for all chronic disease populations, and cancer is a little bit newer to the table. In addition to that focus in the Quality Chasm report on the triple aim of healthcare reform and chronic disease self-management as being a key priority within that triple aim, we also know and understand that Leonard Kish came out with a very compelling statement that engagement of patients in self-management and self-management of health, it could really be compared to the blockbuster drug of the century. And similarly, in the American Society of Clinical Oncology, patient engagement has been likened to the fourth revolution in personalized cancer medicine alongside cancer genomics and all the aspects of personalized cancer medicine. And we do know that patient engagement is one of the core principles of delivering high quality cancer care. Just to make sure we're all on the same page, I just want to quickly define what is self-management, because what we're talking about is coaching for self-management and self-management behaviors. So self-management does relate to the tasks that individual must undertake to live well with one or more chronic conditions. And these tasks include gaining confidence to deal with the medical management, role management, and emotional management of an illness. And then we need to think about in terms of the self-management support side, which is what healthcare professionals do to really support patients and facilitate and coach them in their adoption of self-management behaviors and being successful at those particular tasks of self-management. So it's defined on the slide as the systematic provision of education and supportive interventions to really increase the patient's skills and confidence in managing their health problems. And it does include structuring the cancer system to include regular assessment of progress and problems, goal setting, and problem solving support. From the patient's perspective, there has been, of course, unprecedented advances in cancer treatment, which means that more cancer patients are living with cancer chronicity as a cancer survivor. We know across the whole of the cancer continuum that patients and families hold responsibility for managing complex treatment regimes, multi-system effects, and of course, recovering their health post-cancer treatment. This means that they must restructure their lives to manage ongoing treatment regimes and surveillance regimes when they transcend into the post-treatment survivorship phase. And we do know that the life-altering nature of cancer and treatment is experienced at home outside of cancer clinic visits. And the onus is on the patients to recognize, report, and manage their disease, and of course, adopt health behaviors that can minimize both late effect risks and optimize health throughout the whole of the cancer continuum. It also means they must alter their life goals to really accommodate the changes that are wrought by a cancer diagnosis and cope with the psychosocial sequelae of cancer. Unfortunately, the cancer care system lags in its provision of systematic self-management support, which leaves cancer patients vulnerable to potentially worse health status, as well as potentially worse survival. Subsequently, that means that cancer patients are quite overwhelmed. And as you can see from the next slide that was put forth by the Emperor of All Maladies, Mukherjee, talks about that often for patients, it feels like cancer has taken over their entire life. They see nothing beyond the world outside of cancer, but a world taken over by it. And as stated in this quote, cancer reflected endlessly around them like a hall of mirrors. This quote really speaks to the need for self-management support as I defined in that very first slide, that self-management isn't necessarily something that patients can do alone, especially when they're dealing with the overwhelming nature of a cancer diagnosis. Not surprisingly, patients are overwhelmed. If you look at this next slide where we look at the number of cancer self-management tasks and sort of the core areas of work. So as I said earlier, self-management is about medical management of disease, but if you look at cancer, it is a unique disease in the sense that it is different from traditional chronic diseases. There are many self-management tasks that need to be tackled. Those include illness-related work, which is about managing, of course, all of the life-threatening toxicities of treatment, the symptoms of cancer themselves, managing those ongoing treatment regimes, adjusting and adapting health behaviors across the whole of the continuum during acute cancer treatment, and then hopefully re-entrenching and readopting those behaviors post-treatment survivorship. There is emotional and psychological work where patients have to cope with the stress, the emotional distress of cancer, and what makes cancer a unique chronic illness, of course, is the existential distress that not only treatments present a life threat to the patients, but just having cancer is, of course, extremely life-threatening, and it's very different from other chronic disease, such as arthritis, for instance. Patients really experience changed sense of goals, changed sense of self. They really need to figure out how to recast their biography sometimes and adapt to daily life changes as well as family distress at the same time. They also, part of the work is the everyday life work, managing changes in roles and relationships, intimacy and changes in sexual health, adjusting to new work roles and figuring out how to return to work with all of the potential symptomatology that they experience as a lifelong problem, and dealing with financial distress as part of that. They need to be able to deal with healthcare system work, which is navigating transitions, accessing multiple peer support or other services along the whole of the continuum, of course, managing comorbidities. We know that cancer is a disease of the aging population, and so most patients are not dealing with just one chronic disease. They're dealing with multimorbidity at the same time as they're coping with the stress of a cancer diagnosis. In terms of, that means that across the cancer continuum, additionally, the behavioral tasks. So in addition to sort of those tasks that I just described are the work of cancer self-management, there are multiple behavioral tasks that also differ across the cancer continuum. So when we start to think about cancer coaching, we need to recognize that each of the phases across the cancer continuum poses unique health challenges and require application of specific self-management and health behaviors that patients need to enact in order to optimize their health, quality of life, and survival. And so you can see there's examples under each of the phases of the cancer continuum here with adhering and managing things related to prevention, managing treatment decision-making and diagnosis, and of course, talking all of the issues of a new diagnosis and talking with children. When it comes to cancer treatment, being able to self-monitor cancer symptoms, early recognition of those symptoms and how to report them to their clinical team, titrating medications to hopefully mitigate the physical side effects of treatment, and adjust their health behaviors as they're undergoing all of the inflammatory effects of an acute cancer diagnosis, the need to adjust, their level of physical activity that might need to be different from when they were actually quite well before cancer treatment. And of course, in survivorship, the late effect risks have to be managed. And in palliative end-of-life care, there are new challenges in terms of grief and loss and family caregiver issues that come up that are part of the self-management spectrum that needs to be addressed. So cancer coaching becomes incredibly important to facilitate patients' uptake and adoption of self-management behaviors across the whole of the cancer continuum and at every single phase as shown in that last slide. When we describe cancer coaching, we describe it as a structured, person-centered collaborative care process that views the client as the expert in their illness and life contexts. It does emphasize cancer and health education within a coaching context, so it's not just traditional patient education, and I'll speak to that a little bit later in the slides, but it really is about facilitating clients' achievement of health-related goals. It focuses on motivating self-determined behavior change through a supportive collaborative partnership with the patient. It focuses on building the patient's self-efficacy or confidence, knowledge, and skills, and their capacity to apply self-management and other health behaviors to manage cancer and health. And it focuses and uses a strength-based approach to empower and utilize patients' own strengths and intrinsic motivation to recover and manage health. We're just going to show a video. It's going to take us a couple of minutes because I just wanted you to hear from the cancer coaches in Ottawa and make it sort of even more real than just the text I've been talking about. So Odette is going to be taking over the screen and showing you the video for a few minutes.
Cancer coaching is an innovative health service that helps people with the challenges of living with cancer. Coaching is a one-on-one service where someone can meet with a healthcare professional and really focus on the things that are important to them to get education, support, and practical tools and strategies to help them prepare questions for their first meeting with the oncologist, or help them around improving their diet, increasing their physical activity, help them around how do I tell my kids, supporting them around managing their stress and helping them with transitions like going back to work or managing side effects. Our cancer coaching team is made up of social workers and nurses with a lot of experience in oncology. These are trained healthcare professionals who can really support someone around their various needs. When someone newly signs up to become a client and to access the cancer coaching, they're matched with the cancer coach that has the most experience in the specific areas that are most important to that client.
So I hope that just gave you a little bit of a flavor for cancer coaching beyond just the definition that I just shared on the last slide. What we do need to understand that for cancer coaching to be effective, there are certain knowledge and skills that cancer coaches need to possess. And part of that is actually being able to apply with what we call knowledge and practice, that they actually are able to apply health behavior change theories. And the theories that we particularly teach in health coaching and cancer coaching is self-determination theory, social cognitive learning theory, stages of change theory, and common sense theory, which is really about understanding that patients have their own perceptions of symptoms and their own perceptions of cancer illness that need to be addressed as part of the coaching process. Additionally, the core domain of person-centered communication and motivational interviewing skills are within the cancer coach toolbox that the cancer coach uses within her practice with cancer patients. And the core or essential elements within that particular part of the toolbox is establishing rapport, conducting holistic assessments that assess baseline levels of patient activation, patient capacity for self-management, and really focusing on measurement-based care throughout the whole of the coaching encounter with that particular patient. Asking powerful questions is a part of the cancer coaching essential skills. Collaborative agenda setting tools and techniques that you may be familiar with from your patient education focus, which is teach back and closing the loop. Change talk, really facilitating change talk and readiness to change. So when we're really counseling patients around things like physical activity and other particular behaviors we're trying to get them to adopt, we really focus on their readiness and facilitate change talk. And then of course, building on their strengths and understanding their strengths, which helps us to understand their intrinsic motivation for making a behavior change. In building self-management core skills and of course confidence and self-efficacy of the patients, we use a 5 A's behavior change counseling process. We really focus on promoting mastery learning where patients are setting goals and action plans. They're able to problem solve barriers to fulfilling those action plans, and we help to support their capacity and capability. I'm sorry, my mouse is having a little trouble here. Supporting capacity and capability for self-management, and of course, as I said earlier, advanced motivational interviewing skills for facilitating behavior change. So that means that information alone is not enough, so that there is a fundamental shift to cancer coaching, really from a view of patient education to really activation of patients in self-management. While patient education, of course, is core, as I spoke about earlier, the cancer coach really focuses on facilitating activation of the patient in self-management behaviors. And so the comparison is just shown in this slide between traditional education that really focuses on in providing information, technical skills related to this disease, whereas self-management education that comes in the cancer coaching encounter really focuses on problem-solving skills. In addition to that, the person with the disease formulates the problem, so there's shared agenda setting. That doesn't mean that if there are specific things that a cancer coach needs to address with a patient around managing particular side effects, that she may have an agenda, but it's really about focusing on the patient's agenda related to managing the disease and all the aspects of cancer treatment that are partly related to that or survivorship. And again, as I said earlier, it really focuses on building the patient's confidence, whereas we think about patient education is really about changing knowledge. And the assumption with patient education is by changing knowledge that somehow that will translate into the patient taking action and the patient adopting a particular behavior. And what we hear time and time again when we go out to cancer sites and cancer settings is that oftentimes the clinicians know that they really focus on teaching everything to keep that cancer patient safe while they're undergoing cancer treatment. But they will often say to us, I'm really not sure if when they get home, they're going to be able to enact these behaviors, if they're really going to understand how to titrate their medications related to the side effect of nausea and vomiting or managing their pain. And they're never quite clear. And what they do tell us is that they find that lots of patients are experiencing symptom crises and calling the triage line quite often because we provide them with an overwhelming amount of information and then we're not sure if they can apply it and whether they're able to use it to actually translate it into behavior change. Knowledge alone and information alone will not work. So the focus in coaching in self-management education is of course on self-efficacy, increasing the patient's ability to be effective problem solvers, and that's what leads to improved clinical outcomes. The goal of education might be on compliance, whereas the goal of education for self-management is increased self-efficacy. And then of course, coaching can certainly be delivered by health professionals, peer leaders, or people who live with a chronic disease. And we know that there's lots of programs, such as the Stanford program, that are in existence in many provinces throughout Ontario, where it is lay-led. And that's been their sort of raison d'etre of delivering that particular Stanford program for chronic disease self-management. So as you can see from this slide, information provision is not enough, and that information provision certainly has become more prominent as we've moved to patient-held records, and those become incredibly important for providing information, but they're not self-management unless self-management information or self-management education or coaching is pushed out through them. Electronic information tends to be information providing versus when we start to think about behavior change, that sort of cancer coaching toolbox around the skill sets that need to be in there are related to motivational interviewing, focusing on goal setting. It can be a group education, and of course, self-monitoring of disease is an incredibly important and complex cognitive skill that coaches really work with patients to develop. That doesn't sort of happen just as a natural process. It really does require a great deal of facilitation and coaching. Just to give you an example of that, so a patient experiencing cancer fatigue may not really understand, based on their fatigue level, how to adjust their behavior effectively to actually get in what I might call the sweet spot, for lack of a better term, of a lower level of fatigue and an adequate level of physical activity that they're really facilitating and optimizing their health. But that is a very complex skill to adjust behavior in that way. And cancer coaches really focus on that as part of their behavior change counseling process. In addition to all of those particular aspects of motivational interviewing, we also focus in cancer coaching on building the patient's self-efficacy and confidence and their skill sets. So as I said, building their problem-solving skills, the decision-making, these are the 5 core skills that are really emphasized in self-management support. Decision-making, and decision-making is not just about the decision-making related to, treatment selection. It could be the big D decision-making, but it also can be the very small decision-making that I just described, the example for fatigue, in tailoring and adjusting one's daily behavior to optimize health and quality of life through adjusting one's behaviors in the context of daily living as well. And similarly, self-tailoring is part of that, but self-tailoring also includes mobilizing and finding and utilizing other resources. And the 4th core skill is partnering with healthcare providers, really being able to enhance and advocate for changes in a treatment plan, to be able to actually communicate effectively to the healthcare practitioner the tempo and trends of the illness, and to hopefully early recognize when they're in trouble, and hopefully the coaches are really helping them to build those self-monitoring skills to do that. And then of course, action planning is a key part of that, where it's focused on planning and concrete and attainable aims. So there's another fundamental shift then that's required when we shift to cancer coaching, from shifting to seeing ourselves as experts to coaches. And if you look at the sort of right side of the slide, you see the expert approach. In the sort of traditional expert approach as healthcare professionals, we often see ourselves as the authority, we're the educator, we're educating them about everything to keep them safe. We define the agenda because we know that there's a certain amount of education or information that they need for us to feel confident that they can manage those life-threatening side effects of treatment toxicities, as an example. We feel responsible for the client's health. We feel that we're there to solve their problems and to support them and hold their hands through their experience with a cancer diagnosis. It tends to focus on what's wrong rather than on strengths and what's right about the particular encounter. The healthcare professional may feel they have all the answers and may actually feel that they're working harder than the client, and they wrestle with the client to make behavior change. We hear those, statements so often from healthcare professionals, why does she not just adopt that healthy nutrition, adopt that physical activity? It becomes like a wrestling with the client. Versus in the coach approach, it's really about a partnership relationship. It's really being about facilitator of change in health behavior, really eliciting the client's agenda and knowing that the client is responsible for their health, but we actually can facilitate their ability to optimize their health through what we do in the cancer coaching encounter. Focuses on what's right. So what are the strengths that this person brings to the encounter that we can build on? And together, the coach and the patient co-discover the answer. They learn from the client's story, and they can work clients work as hard as coaches. And in a sense, a cancer coach is in a sense like dancing with the client. They're moving with the client, they're changing their steps and according to where that client wants to go and where that client particularly wants to go in adopting health behaviors and managing their health and all the other aspects of managing a cancer diagnosis. Cancer coaches, as I said earlier, use the 5 A's self-management behavioral coaching process. And so it's similar for those of you who are nurses on the call. We always think about the nursing process, but this is the coaching process. So it is about assessing, advising, agreeing, assisting, and arranging and developing a personal action plan that is consistent with the patient's goals. And you'll see an example of that on the next slide. So here's just a simple example. I have many others that are much more complex for cancer fatigue, cancer breathlessness, and other symptoms, even immunotherapy. But we do know that here's a good example. So in the ask of this counseling process, it might be an example of how much exercise do you currently do? If not, you might be advising on exercise recommendations. We always ask patients, is it okay if I give you some more information or tell you a little bit more about exercise and the effects of exercise on cancer symptom side effects? We don't just sort of jump into advising. It's really about making sure, again, that we're not focusing on our agenda. And then assessing would be, is regular exercise important to you? So again, the readiness to change, the change talk, understanding that as part of the assessment process. Assisting them by having them set a very clear action plan and a set of goals, which might be as simple as starting with 10 minutes of walking a day. And then of course, arranging. We know within a busy clinical rapid episodic cancer environment, it's extremely difficult to facilitate, change in some of these healthy behavior lifestyles in a very, very short rapid episodic visit. So it might be connecting them to a program to get them started on that particular journey. So just putting it all together, we think about the provision of effective self-management really facilitates those acquisition of the 5 core self-management skills that I just talked about. The mechanism by which those things come together to actually facilitate the behavior change is through the enactment of skills mediated by self-efficacy. Again, patients of knowledge, confidence, and ability to actually manage whatever they're facing. And then of course, it comes back to those 3 areas of the overarching tasks for disease self-management, which is medical management, emotional, and role management as well. So why is this important? I want to make sure I give you lots of time for questions at the end. Why does it matter? We do know that poorly managed physical symptoms and mental health, unrelieved or unmanaged mental health issues in cancer is very costly. It's really quite surprising to me that we still hear from patients, we're doing qualitative interviews with patients about self-management online programs, and we're still hearing that they're really feeling very much alone in what we call managing the hard work of living with cancer. And a lot of the times it's that there's a lot of attention to the physical side effects of cancer treatment, a lot less so on mental health. But you can see on the stuff from the slide from Cancer 2020, on the left-hand side of the slide, in a very large population-based study, that cancer survivors, and I would contest or hypothesize that all of these psychological problems are occurring early in the continuum, even at the early acute phase of cancer treatment. And you can see that, patients who are cancer survivors have, twice the amount of major depressive episodes compared to a control group, the 9.6%, serious psychological distress, suicidal thoughts that are much higher levels of any mental illness and serious mental illness. And those were all clinically significant. And then what we do know from this systematic review of healthcare costs related to mental health conditions among cancer survivors that was done by Kushalani is that mental health in cancer survivors costs about $30,000 per individual patient over the life course of a cancer process or clinical course of cancer. So it's very costly. And in addition, in Ontario, we do know that patients who are undergoing adjuvant or primary first-line treatment of cancer, about half of them or more end up in hospital within the first adjuvant cancer treatment cycle, and not all of those are related to febrile neutropenia or low white blood count. They in fact are related to pain and other very treatable, manageable symptom problems. And so there is a costly problem of emergency department use and unplanned visits by a whole range of our breast, colorectal, lymphoma cancer populations, et cetera. We do know from research in the US by the group that's Judith Hibbert's that's worked on patient activation, is that the more activated a patient is, that they will have less readmissions to the hospital. So less, kind of like focusing on the less activated patient, has a higher admission rate to hospital within 30 days of discharge. They experience more medical errors, almost 3 times what the more activated patient does. They have poor care coordination between healthcare providers. They may suffer a health consequence more frequently because of poor communication. In addition, they lose confidence in the healthcare system. We also know that there is a fair amount of systematic review work that's beginning to emerge in cancer, although the research in cancer populations regarding the efficacy of self-management is really emerging. It's not as well developed as it is for other chronic diseases, but we do know from studies such as Ruth McCorkle's that, and as well as our own under the Cancer Care Ontario website, we did do an evidence review of self-management education and its effectiveness. And we do know that across the continuum, as she analyzed in this particular systematic review, that there are beneficial outcomes from self-management cancer coaching, and those include reduction in severity of symptoms, reduction in psychological distress, and improvement in quality of life and physical functioning as well. We also, of course, know when we start to think about both across the continuum, but particularly in the post-treatment survivorship phase of cancer, that exercise has become the new blockbuster drug, if you will, for cancer and many other diseases. And we do know that it can reduce the risk of cancer recurrence and improve survival rates for cancer survivors. And it is strongly recommended that all patients receive a prescription, but receiving a prescription for exercise and really being able to enact the particular prescription is where cancer coaches can come in and support the patients to facilitate their adoption of those exercise behavior, which can be very difficult, especially when you're undergoing active cancer treatment. And additionally, we do know that other healthy behaviors, of course, healthy nutrition, which I haven't really addressed very much, but quitting smoking is also fundamental. And there's certainly data out now that even patients newly diagnosed with lung cancer or even preceding a lung cancer diagnosis who quit have a better prognosis and a better survival. And so smoking cessation becomes an important area that cancer coaches work with patients to facilitate their readiness to change, hopefully moving them to greater readiness to change and to facilitate their ability to create action plans about smoking cessation. That again facilitates health. So when we put it all together, once again, we think about cancer coaching for self-management as really the model for future healthcare. And this is what we've conceptualized in this particular framework, that again, coaching support is available to patients. It's integrated within part of routine cancer care. It might mean that there's a requirement for a stepped approach that all cancer providers provide a certain level of cancer self-management coaching. And then additionally, similar to diabetes, there will be very trained cancer coaches who have those more advanced motivational interviewing skills for facilitating behavior change that could be available within the cancer system, similar to the same way that they're available for patients with diabetes, to mitigate the disability that can occur as a result of that particular chronic disease, and could be the same for cancer patient populations. Cancer support, as I said earlier, there are many, many behavioral tasks. So the opportunity to actually think about cancer coaching across the whole of those 4 phases of the cancer continuum shown in this diagram. And then really thinking of cancer coaching requiring both some of the navigational elements of a navigation role, but also combined with everything related to coaching for self-management. So if you remember that very first slide when I talked about the cancer tasks, those cancer tasks include, you know, facilitating transitions, navigating the healthcare system. So navigation needs to be a fundamental element of cancer coaching as well, or the skill sets. And for oncology cancer nurses, that's certainly the case, that it is articulated in standards for cancer nurses that navigation is part of, or one of the core skills as well. And then across the bottom, you see the coaching role categories that I've spoken about that were part of the Cancer Coaches Toolkit and set of knowledge and skills that are required for cancer coaching. And then all of the components around the self-management support skills, some element of motivational interviewing that may be the basic fundamentals of motivational interviewing, communication skills that any healthcare provider, even a rapid episodic visit, can use, but then the more advanced might be in a stepped care model within the cancer care system. The collaborative relationships, of course, everything about building self-efficacy and those core skills, enabling the system navigation. And we think of all those are combined, that it will translate into patient activation in symptom self-management and self-management behaviors and for health recovery. And that will be less costly because there will be reduction in emergency department use and likely better survival. So when we start to think about this, it really means, especially within the cancer system, we really need to shift to that chronic disease self-management mindset that's been put forth for all chronic diseases around the world by the World Health Organization and within our own in provincial organizations and federal organizations at a pan-Canadian level. And it's really shifting to that new mindset. And if we do that, I think we can start to see hopefully better health outcomes for patients. Not only that, we're just not leaving them alone with trying to manage and figure out how to take all this information that we often provide them and actually translate it into health behavior change. So self-management, I do believe, is one of the most powerful resources we have in healthcare. It's really fundamental to optimizing patients' ability to manage both their disease, their health, and live fuller, healthier lives with extensive health quality. And you can see earlier, as per those studies that I quoted, that it actually can translate into better survival, reduction in health service use, et cetera. And of course, yet it is one of the least utilized aspects of personalized cancer medicine. So I just leave you again with the patient's perspective. I began with the patient's perspective. I leave you again with the patient's perspective, and acknowledge once again that, you know, when we think about self-management, it does require self-management support be available and integrated within the cancer system in order to not leave patients alone with this kind of situation, that they're trying to live with an illness, that they really, you know, it's the chronicity, it challenges all their emotional strength. They're already dealing with the diagnosis of cancer, and then to try and navigate everything that they need to in terms of the cancer self-management tasks that I spoke about earlier can be quite challenging. And I'm going to end there and open for questions. So I've left 15 minutes, thank goodness, for some questions, and I'm going to see if I can get back and get to the chat.
Hi, yeah, Doris, it's Tanya, and we do have a question in the chat from Hope Gillis. Do you see the chat open, or I can read it out for you?
See the chat.
I'll read it out for you.
Let me just see if I can get down in the chat.
Okay. Well, I can read it out for you if you don't see it.
I think I'll be right down at the bottom from Alexandria and Hope.
Yep, there's one. Yes, and Alexandria's just came in too.
Let me just make sure I read the whole question, because you've got a big paragraph there, Hope. I'm not totally sure I understand, but if I think I understand, let me just see this traditional treatment. I guess what? Yeah, yeah. No, I think what you're raising, Hope, is I think, you know, I think cancer coaching and self-management should be part of everything that every healthcare professional does across all of the phases of the cancer continuum, and cancer treatment is one of those areas. Our challenge is, of course, a lot of the work around cancer coaching and motivational interviewing has been done with, healthy lifestyle change versus the acute phase of cancer treatment. So we're learning in some of our newer studies around how do you apply these elements within acute cancer care environments. But we do think that it is part of everybody's capability that they should deliver this. But of course, we kind of differentiate between the skill sets that can be integrated within a rapid episodic cancer environment, given the short nature of the visit, to a set of core skills such as establishing rapport, setting the agenda, setting an action plan for sure, evaluating patient activation, teaching back, all of the kind of skill sets that I spoke about earlier. Whereas we think about cancer coaching requiring more time and those having a specific dedicated amount of time to coach patients. But I think the coaching can still occur in regular routine care. But all of the elements of readiness for behavior change and all the elements that requires time to do, I think is probably something that has to be done by designated health coaches, designated health or cancer coaches, hopefully integrated within the cancer environment. So good for you that you're actually doing some of that coaching within traditional treatment, because I think it's fundamental. And so cancer coaching program primary care is actually done more related to chronic disease self-management in terms of adopting coaching models, collaborative care models, which are about coaching for depression, et cetera. Primary care is done more. We're just doing a systematic review of looking at implementation of cancer coaching in the cancer setting, and there's hardly any articles or any studies that have actually shown how do you implement this in the type of cancer environment within which many of us work. But in primary care, there's lots of newer models. In fact, when I took the coaching course at York, there were many individuals who were coming in as coaches, health coaches, but they were starting to think about, gee, and we never even thought about the cancer patients within our primary care or our family healthcare practice. So I think it is one, and there's a lot of literature around how to implement that within primary care, more so than in the cancer system. And yeah, so I gave the example, so from the cancer coaching program in Ottawa. I think within a lot of cancer survivorship programs, which is where the cancer coaching program sort of hails out of within the Ottawa program. So I think within a lot of the cancer survivorship programs, self-management and cancer coaching, they may just not call it cancer coaching, but they certainly do a lot of a motivational interview for physical activity, behavior change, healthy lifestyle behavior change. But I'm not aware of, besides the quality statements that Cancer Care Ontario put out to try and facilitate change within cancer settings towards better adoption of cancer self-management, coaching, cancer self-management in routine care. They did put out the quality statements, but I'm not aware of them hiring cancer coaches outside the Ottawa program. And there's certainly support for private practice within this field and area. And, you know, I learned about some of that in the cancer coach program at York, or the York program on chronic disease self-management. And there's certainly other resources out there as well. So Hope says she is providing, that's great, has been approved by the Nova Scotia College of Nursing. That's fantastic, Hope. So we're just pulling together around the world globally. We're pulling together all of the International Council of Cancer Nurses and all of the cancer associations, such as the Canadian Association of Nurses in Oncology. And what we're going to do is establish, and we just put out in Cancer Nursing a call for action for nurses to actually be trained in cancer self-management coaching. And we are now going to work in a collaborative role with all of the cancer associations globally to develop and endorse a core curriculum all of those things that you saw in the coach toolbox. So how do we actually think about those as part of basic education? How do we think about those in terms of D'Souza nurses? How do we start to think about them in terms of oncology nurses and the competencies related to oncology nurses, and that they will integrate these specialist competencies related to self-management coaching as part of their role as well. So we are working on that. Love to make contact with anybody who would like to provide feedback and input into that. So in Canada, there is no certification for cancer coaching. The national body in the US, and you can see on the advertisements for this particular cancer coach training that we'll be doing, the National Body for Health and Wellness Coaching has accepted the course for as a credential towards the cancer coaching, but you still need to pass the licensing exam. But there's no comparable body yet in Canada.
Doris, there's also a question from Errol, a little bit up there.
Oh, did I miss it?
If it's Errol, if you recommend and advise the health professional to try and change the mindset of the patient, and as well, how would you approach a difficult patient that is ready to give up after the diagnosis experience?
I think I would really first try and sort of establish that rapport and try to understand where they're coming from. What really is all that about? I mean, sometimes people are giving up because they don't really know the steps or actions they can take. You know, it was really surprising in our study, which is called the Smart Care study that we've just finished up recruiting for. It's a very small pilot study. It was interesting, patients that, because they're getting both cancer coaching from oncology nurses that we've trained, but they're also getting an online program in self-management. And interesting, patients who completed the whole program, particularly the online program, said, you know, I didn't even realize that there were things that I could do to improve my health. I didn't really know that there's actions I could take that would make the difference. And what they found is when they started to do action plans, and they were doing action plans like every few days, like one should be, that it actually gave them hope and a sense of progressing through very challenging cancer treatment side effects. So I think but of course you have to first start with that, where that patient's at. And one of the things I didn't include in the slides when I look up at the cancer continuum, but when you start to think about the acute phase of cancer treatment, patients are overwhelmed and may not have the full capability for enacting some of the self-management behaviors. And so we really have to pay attention to the fact that they may have so much distress and stress related to the cancer. We have to address that before they can adopt self-management behaviors. So you really have to start where the patient's at. You really have to understand what it is that they see that they can take action around, and then start facilitating small baby steps towards the goals and actions that they can take. But as we teach them that process, I hypothesize that in fact, they'll be able to apply that across later stages of the cancer continuum, even as they move into cancer survivorship. And maybe if we really start very early in the cancer continuum, we will get them early enough that in fact, maybe some of the disability we're seeing post-treatment survivorship, we can maybe mitigate or ameliorate or minimize some of that as well. We've also, a student of mine did a fairly extensive scoping review around advanced and end of life and needs of patients related to self-management facilitation or self-management coaching. And certainly that scoping review, and there's a couple more recently, have shown that self-management in palliative and end-of-life care is very important, but in fact has not necessarily been a traditional approach within early interdisciplinary palliative care services. We teach patients self-management related to symptom management, but I'm not sure it's self-management from all the behavior aspects that we're talking about here. I hope that answered your question.
Doris, we had another question related to how do patients receive cancer coaching? Through a doctor's referral? Are they directed after getting the diagnosis?
So in the Ottawa program, they've just made that a free available service to anybody who finds out about them. They can self-refer. So you would hope that that could be the case, but if you think about diabetes and others, usually you're referred to a diabetes coach as part of your prescription from your medical team. In terms of, you know, private coaches that are out there, then there's certainly more of those emerging. Then certainly patients can self-refer to any of those programs. What we're not sure about is a lot of the pop-up programs for cancer coaching. We're not sure the level of training, and we're not sure if they're licensed and certified as cancer coaches. So those are important things to tell patients, you know, in your work with patients, that they actually, if they're thinking about getting a coach of any sort, that they really understand, the same as they would with alternative therapies, what do they need to know about that before they decide that that's a good coaching service.
And Doris, it's Tanya from York University. I know as educators, we struggle with this one too, is how do we help our coaches or people we train get better connected into the system? So we're always looking for new and better ways to do that. I think there's some work there we can do. Perhaps it is connecting with primary care to let them know that people are graduating from our program, and maybe some way to connect them. We'll have to work on something.
Yeah, one of the quality statements that has been put forth by Cancer Care Ontario, one of the indicators of quality related to is connection with community services, so that there's better integration. So even the chronic disease self-management programs that are running kind of across the board in Canada from the Stanford program, many of them that have been trained in your program, in our, you know, the York program, except if they're peer-led, which is the Stanford approach, you know, connecting with all those potential resources. And we find patients will say, I had no idea, you know, about peer support. I had no idea about that there was a cancer thriving and surviving program in my community, and I didn't really know how to access it. So that is one of the quality indicators in the Cancer Care quality statements, that there should be better integration and connection with community services so that patients can get access to all those particular coaches wherever they might live or exist, and programs.
So a lot more work we need to do too.
Yeah, we got to shift the system.
Yeah, we do. A question from someone, and this is related to then for the person with the lived experience. Can you recommend an online self-management course that is free for patients to take? I was trying to think myself of what organizations I know of that would.
Well, I just know of I know that Educan Australia has, they put some things out, and I think those are free, although I don't know that they may focus on what self-management coaching is, but they do give really good patient examples. So it's Educan Australia. On the UHN website, there's a very, very short video, and I don't know if those can be accessed externally, but I expect they can. And that just gives a little bit of an overview of cancer self-management and the focus of that. And on that Cancer Care Ontario website, if you actually go to Cancer Care Ontario, the toolkit for self-management support, there's a fair amount of resources and links to videos and other things that are there that are part of that. But of course, you know, the chronic disease self-management programs that are offered throughout every single province, and certainly within Ontario, there are many that are running constantly in every single community. You can also go directly to the before it was the Community Care Access Agency, Home Care Agency, I'm not sure what it is now, but you can actually pretty well easily get them through any of those home care access agencies. And those programs, the 6-week programs, are both online now, as well as patients can attend as a group and have peer-led. Again, the focus has been on, you know, overarching one-size-fits-all chronic disease self-management, but the Cancer Thriving and Surviving program is specifically been tailored for cancer survivors, and those are available in communities throughout Canada as well.
Thank you, Doris. Thank you. And we are at 2 p.m. everyone Eastern Daylight Standard Time, Daylight Savings Time, sorry. Thank you all for joining us today. We had a very big group. Thank you for your patience and asking questions. And your questions informed other people as well. And we're getting a lot of thank yous. We really appreciate you giving us your time today. And if you have any follow-up questions, feel free to email us. There is the contact information for us at HLN. And also, Doris.
And love to hear from some of you that are doing cancer coaching.
Right? Yes, let us know. Please, you can contact Dr. Howell through us. Yes, we'd love to know about you cancer coaches. More, give us more details. And if anyone also has questions about the research that was presented or any additional information, they just want a little bit more info, please reach out to us. Let us know. And you're very welcome for those enrolled in the course. Looking forward to seeing you this summer. Please continue to watch our line for any additional information that we can send to you regarding cancer coaching or similar topics like health coaching, motivational interviewing, and even patient navigation. I saw that mentioned as well. This webinar has been recorded and it will be sent out to you. And thank you again. Thank you, Doris, for your time today. Really appreciate it.
Thank you, everyone.
Yeah. Take care, everyone.